was Hassan. That's what we said yesterday, right?
Yes. The first station is splenic hematoma. Hassan, are you ready?
I'm ready.
I will be his patient, Muhammad.
I think, Ali, you should be the patient for... no, you can be the patient, yeah.
Okay.
So the scenario is you are a surgical doctor.
But from next week, from the next session, I want people to prepare to be the patient. We're going to organize it later after this session, okay? Let's start, Muhammad.
You are a surgical doctor asked to discuss the case of middle-aged male patient who has sustained fractured ribs and subscapular splenic hematoma. Despite being hemodynamically stable, the patient hemoglobin has fallen from 10 to 9, indicating potential ongoing bleeding. The patient, Mr. Anderson, has expressed a desire to leave the hospital. You have 8 minutes and yes, you have 8 minutes and 40 seconds to introduce yourself and use clear and empathetic communication to explain Mr. Anderson's condition and the importance of remaining in the hospital, okay?
Hassan, can you open your camera if you can, please?
I'm not ready.
That's all right. Try to, for the next one, try to open your camera so I can see your facial expression.
Okay.
Okay, so
Yes.
8 minutes and 40 seconds started. Mute yourself, please, everyone. Okay.
Hi, doctor.
Boss, I will give you boss.
Hello, I'm Dr. Hassan. I'm the treating doctor for you today. Nice to meet you again, Mr. Anderson.
Hi, doctor. Nice to meet you.
Yeah, I understand from sister outside there you want to leave. May I discuss with you your concerns?
To be honest, I don't think you're going to solve the problem, doctor. I'm really unhappy with staying here. I want to get out of this hell as soon as possible, please.
Yeah, Mr. Anderson, I understand your concerns and your worries. And I know staying in hospital is very frustrating, but it's very important to stay here in hospital. We just do admission as we recommend admission when truly needed. So, Mr. Lee, very important for us to stay in hospital. Am I clear so far?
It's very important for you, but it's not important for me at all. And if you notice the way you speak, you just focus on yourself. You just want to keep me here. You want to do your job, but you have no regard of my emotion and what I want to do.
Okay, I understand that, understand your concerns and understand your worries. But do you know, firstly, what do you know? Could you tell me more about your condition?
Yes, you should be aware of that. But they said I have a blood collecting in somewhere. Nobody was clear for me, and it was just a vague information, to be honest.
Okay. Let me explain to you more. You have what we call it is splenic hematoma. Spleen is an organ located mainly or located on the left upper part of your tummy, and is important in the immune system, and is working as a defensive mechanism against viral and bacterial infection. So you injure this organ when you fall down and there is collection around it, and there is risk of internal bleeding. Am I clear so far?
I'm not sure why you speak with me like a military. I know you are clear, but that doesn't make sense to me. Okay, I have this blood collecting. What you gonna do? You gonna take me to the operation? I said I want to leave, doctor. Well, like I don't understand the importance and the correlation between this blood that collected, you said in my tummy, and the need of you keeping me here.
I see. Okay, let me explain more to you what's going on. Your condition, there is this collection, and with this collection and your hemoglobin is your investigation show your hemoglobin is dropping, So we afraid you can develop internal bleeding, and this serious condition and can lead to loss of your life.
Oh,
How does it sound to you?
now, yeah, now you're playing with the life card. I do understand. So, look, doctor, my wife has a cancer and I need to take care of her. I want to get out of here.
Mm. I'm really sorry to hear that about your wife, but it's very important. Your health is my priority. So we need to keep you here, and also I can offer for you for your wife a social worker. She can or the social worker can accompany your wife to the hospital.
Yeah, but
And
yeah,
okay.
yeah. What do you want to say?
Yes, I said if we can offer for your wife a social worker, she can help her or he can help her.
But I'm still not convinced. And you said you're gonna offer a social worker. I'm not sure if this is gonna happen tomorrow. This is gonna take ages, doctor. And I have also an interview I didn't tell you about. I've been unemployed for a year now, and I really want to get a job. So by keeping me here, you're gonna just take the opportunity of having the job from me.
Yes, I see. I know I know this job is very important for you.
Yeah, it's my life.
But
It's my life, doctor. Yes, it's very important. Yes.
yes, yes, we can figure it out. We can give you online. We can do it. You can do it online. We can give you or offer for you laptop and network. And also, if we
Yeah, but
can't, we
the employer wants me face to face, and you're saying you're gonna do it online. That's not won't work, doctor. I don't think this will work.
okay. I see. So, Mr. Anderson, I can take his phone, employer phone, and I will talk with him and reschedule your interview. How does it sound for you?
It doesn't sound good. It doesn't sound good. I'm still not convinced, doctor.
Okay. At this point, if you insist to go, yeah, I will give you a paper. Is discharge against medical advice that clearly um, that clearly that clearly said you are responsible about any complication happening to you outside the hospital. But before that, I want to ask you, or I want you to repeat what we have discussed to make sure you understand that correctly.
You
What
said
we
I
have
have
discussed.
splenic hematoma. You said
Yes.
my hemoglobin is decreasing. You said this could
Yes.
be a very serious issue, and I need to stay, but I don't care. I need to leave.
Okay. So you should sign this legal paper, and after that,
Okay, bring
you
me the
should.
paper. Bring me the paper.
Okay, sister, give him the paper. Okay.
Yeah, I will sign it. Consider me signed it.
Okay. Okay, so I want to give you some red flags. You should follow it. At any time, if happen, you should come urgently to the hospital or you can call emergency room. The flag sign you should follow maybe vomiting or tummy pain or nausea. If any of them happen, you should come urgently to A&E and I will give you my number. If anything happens,
What are
when
these
you
red
come,
flags you just mentioned? Can you say them again?
nausea, vomiting, tummy pain. Is that
Okay.
okay?
Yeah, I will keep an eye on
Okay.
this.
Okay. Now I am going to summarize what we have discussed. You
Doctor,
come,
you talk
you
too
are
much, doctor. You talk too much. You talk too much. We already summarized everything. I just want to leave.
okay. Okay. Now you are free to leave. But to
Okay.
summarize what we have discussed,
Yeah. Okay. Last summary.
yes.
Last summary, please.
Okay, to summarize what we have discussed before, you have visited here because of splenic hematoma, and you insist to go and you signed discharge against medical advice, and the red flag was were advised. Okay, you are now free to go, Mr. Anderson.
Okay.
Time up.
All right.
Thank you.
I'm going to start quickly, Muhammad.
Yeah.
Good,
I
Hassan.
think you will
Hassan.
take all the session of communication skills.
That's all right. So Hassan, good presentation. You answered all the questions right. Expect this level of rudeness during your exam or even more than that. Okay? Your patient will be very rude, very aggressive. I had my patient was yelling at me. She said, "Don't call him my husband," and that. So, yeah, expect that. You will find a rude patient. The small grammatical mistake or a sentence you said that you can make better. For example, you said, I just showed you. You can just say, I just pointed to you the sign and symptoms. You can say, you said red flags that you should follow. It's not you shouldn't follow the red flag. You should say there's some red flags that I want you to be aware of.
Observe.
Yes, to be not to follow them, but to be aware of them.
Yes.
And if any red flag appear, you should contact us. Your red flag had nausea, vomiting, tummy pain, but you forgot dizziness and
yes.
lightheadedness.
Yes.
Okay.
That's very important because if he internally bleeding, he will develop dizziness. Okay. I want you also to. You mentioned my name. You've been sympathetic when I said my wife. You said I'm really sorry for your wife, but I want you to keep your energy up, Hassan. Like speak with some enthusiasm or whatever. Okay. Increase your power of speak. Increase the power of your tone. Don't speak like you are sleepy or tired.
Okay.
All right.
Yes.
And I want you to listen to your recording from A to Z and give yourself feedback. I did this right. I did this wrong. I should say this sentence faster. I need to memorize this. I need to stop. You should revise it by yourself. That's why we're recording. The main purpose of the record is for everyone to review his station.
Okay.
All right. But you're gonna pass this station. That's a pass. Just work on this improvement in the grammar in the way you say the sentence.
Yes. Very nice presentation, Hassan. I have 3 points. The first point, I can't remember exactly what did you say, but the first point, I wrote it in my paper. You should ask your patient, can you tell me what do you know so far about your condition? I think you said something complex.
He asked me this question, but he asked it a bit later, but it's fine. He said, can you tell me what do you know about your condition?
Can you tell me what do you know so far about your condition? Yes. The second point, you said to your patient, you may develop internal bleeding. But your patient has hemoglobin dropping. You should say you may have internal bleeding. The last point, when Ali said to you that you summarized it before, you should insist, as you did, you should insist to summarize. I want to confirm that you understand it. Okay?
Yes, I think that's a good point, Muhammad. If your patient said, doctor, you summarized for me before, why do you want to summarize again? That doesn't make sense. You say, all right, Mr. Anderson, I'm just trying to make sure that we are in the same page. I just want to make sure that you understand the information. Okay?
So perfect. Another presentation. Should we go to the next station?
برضه يا علي بس في نقطة بتاعت إنه قال لي I will give you my number. This is not possible.
No, he didn't say I will give you my number. He said I will call your employer for you.
No. When he returned back, when he returned back to the hospital, if he feel any one of the red flag, he said I will give you my number. This is not possible. You can't give.
So from practical point of view, we don't give our personal numbers to any patient. We advise the patient to just come to the A&E. And then we will see them in the A&E. And
He
then
can give the number to the A&E team or A&E nurse or A&E doctor.
Yes, we don't give the number to the patient.
Yes.
Yes, that's totally right. Yeah.
Very nice point, الفاتح.
الو علي.
Okay.
ايوه تفضل.
Of course, I faced this station in Bahrain 2024 March. The patient is typically did what Ali did now, and even more. He many times tried to get out of the room.
Okay.
And
Nice.
angry to leave. I don't want to listen to me even. I face it really this station.
Yeah. So just we're doing our best here just to prepare everyone to be to develop those skills. Your patient may shout, may be angry, may threaten you. Everything could happen. Yeah.
Okay.
To be honest, when I read this station, I'm sure that if I read this before, I can manage it better. I know
Yes,
how
madam.
to deal with this patient.
You should have come to us from the start then.
So Ali, we request time. We request to do the role of the patient in the communication station as much as you can.
Oh yeah, fine. I can do
Yes.
because I will be very aggressive. I can do all the communication.
Yes, it'll be very fine.
Yes.
Okay, Muhammad, let's move to the next.
So the next station is counseling.
Muhammad also can show you another face.
Okay.
Okay, let's move to the next.
Okay.
So the next station is counseling for OGD, and who will take this station?
Let me take it.
Al-Fatih. Okay.
Okay.
Al-Fatih, the scenario: you are tasked with counseling a patient who has dysphagia and scheduled for an esophageal gastroduodenoscopy procedure.
Okay.
The patient is holding a tissue due to excessive salivation.
Yes.
Your role is to explain the procedure, address the patient concerns, discuss potential risks, and obtain consent. To
Okay.
introduce yourself as a surgical doctor, use clear empathic communication to explain the OGD procedure, including its purpose and what it entails. Okay, you have 8 minutes and 40 seconds. Starting.
Okay. Hello.
Hi, doctor.
I'm Dr. Al-Fatih Ali, one of the surgical doctors here today. May I confirm your name and age, please?
Hi, doctor. My name is Tess. I'm 45-year-old.
Your again, please. Your name is what?
My name is Smith. I'm 45-year-old.
Great to see you, Mr. Miss, today. So, Mr. Miss, can I ask you how long, how do you know so far about your procedure or your investigation you have been scheduled for?
To be honest, no, I know nothing. They just told me to come here, and a lot of doctors promised me that they will explain, but nobody explained nothing.
Okay, don't worry, Mr. Smith. I'm here to explain to you. So let me explain to you. You are going to do what we call gastroesophageal duodenoscopy. It is a procedure done under numbness agent. You will not feel anything during that, but you can it is we are going to introduce I want to draw Mr. Ali for you.
Okay, yeah, show me.
Okay. Mr. Smith, we're going to introduce a camera through your from mouse through to your foot pipe.
Yeah.
Like let me show. This paper. So this is imagine this is your mouse. We are going to introduce a camera with through your mouse and to pass through the foot pipe then to the stomach, and small part of the small intestine. Okay.
Oh yeah. Okay, doctor. I
Okay.
think I think that's very clear for me. You said the procedure will be done with numbing agent. Will I still feel some pain, doctor?
I think you will not feel some pain because this will give you a numbing agent, but you can still see the procedure because the camera relay a picture in the TV in front of us, and also this camera can show what is going inside your food pipe and stomach, and also can take tissue for to analysis in histopathology to help us in find the diagnosis of your problem. So you will not feel any pain.
I'm not totally convinced, but I just want to know what are the risks of this procedure.
Yeah, as you know, there is no surgical procedure without complication or without risk. We will start with broken. One of the risks is broken one of your teeth, and also we can get through the food pipe or your stomach, and also there may be a risk of bleeding or infection. Don't worry, because if I mention this risk, that doesn't mean that it will gonna happen, because the only trained doctor and experienced doctor are allowed to do this procedure. So you are in safe hands.
Yes, but is there any risk of you perforating my food pipe?
Yeah, there is a risk for perforation because
wow, man,
you get through.
Why are you saying it so calmly? If you perforated this one, I will be hacked up, aren't I?
No, come again, please.
If you perforated my food pipe,
okay,
that's a big issue, right? Why are you saying very calmly?
No. I mentioned to mention this procedure, as I mentioned, to mention this risk is not. It is not gonna happen. Just to make sure, to make aware about if it is happening.
But it might happen, right? It might happen.
Still, it might happen, yes. But because you are in safe hands.
No. Listen, doctor, I don't want to proceed with this operation. Sorry.
I want to make sure. I want to assure you, the only experienced doctor, only trained doctor, can make this procedure. You are in safe hands. Don't worry.
Oh my God! But to be honest, you're making me anxious.
No, don't. I'm sorry for that. I'm really sorry to make you anxious, but this is your right. You have to be aware about any possible complication. This is for legal issue.
All right. Okay. So can you answer the question? Why am I salivating too much?
Thank you very much for this question, because a normal patient, the saliva tend to go down, okay, because of gravity. But because you are some lesion in the food pipe or due to obstruction, the saliva is being stopped from being going down to your stomach, so it is being dribbling or saliving because of this issue, because of this obstruction. So to do this investigation.
It's clear from what you said.
Clear, okay.
Yeah, it is a cancer, doctor.
It is early to say this is a cancer, because we have to do many investigation. One of them is this procedure, and we have to do imaging and take a tissue biopsy to see what is the problem exactly. We can't say this is a cancer for now.
Do I have to stay in the hospital post-operation?
Thank you for this question. This is a day case. We can go immediately after the procedure, but I want you to arrange someone to take you, or you are not, because you are not allowed to drive, because this anesthesia, this numbing agent may make you drowsy.
Okay. All right.
Okay.
So you will discharge me 90%, but there's a chance I will stay. That's what you're saying.
There's a chance of stay if there is any need to stay, but it is a decades.
Okay, fine. Okay, that's all right. Yeah.
How does it sound for you?
Yeah, that sounds clear. Yes.
If you, Mr. Smith, if you have any question more, please let me know.
No, I don't have any question. No.
So to summarize conversation, what we have gone through, you have been scheduled for gastroesophageal which is called the OGD, and this is a day case under numbing agent, and it is a day case. I explained to you the possible complication and possible complication, and you agree to do the procedure. Just let me to bring the paper and sign and consent for agreement to proceed on this procedure.
Yeah, give me the paper, I can sign.
Yeah, this is the paper. And if you have any question, please let me know. And I'd like to thank you very much for your time. And thank you very much again.
Thank you, doctor. All right, how many minutes, Muhammad, remained? I think
3 seconds. 3 seconds.
Okay, fine.
Time up.
Time up. Okay. Do you want to start, Muhammad, or you want me to start?
Okay, you can start, Ali.
Okay. Al-Fatih, good, very good. You answered all the questions right. To be honest, I got anxious at the end of the station. You know why?
Why?
I was afraid that you're not going to consent me.
Ah. He didn't do that, Ali. He just summarized. By summarization.
No, he said
he should explain to you the paper. You should sign it.
No, he said that, Muhammad.
He said this point at the summarize, not
at
the point. You should know it.
You didn't get my point. He said this a paper. I will give you the paper to sign it. That's what he said.
Yes,
you can review the record.
But in the summary, not at the points.
No, he said I will give you the paper to sign it at the end. So Al-Fatih, your main goal of this consultation is to consent the patient. You should literally say, okay, Mr. John, now I will bring you the paper. This is the paper. I want you to sign here.
Okay.
And you give him the pen and you watch him sign. If you did it at the end, but you just gave it less important and you just gave it less time.
So to do it perfect, what I have to do?
After you finish and he said that's all right, fine. You bring any paper.
Okay.
If they give you a consent, you bring the consent. If there's any paper, you should take a paper with you. Okay, Mr. Anderson, I want you to sign here. Here's your name. You just acting, even if it's a paper like this. I want you to sign here and then let him sign. Because your main goal is to consent the patient.
Before the summary or after?
It doesn't matter.
Okay. So I did it right? You
did it, but you just need to make it perfect. You said, I want you to sign the paper. You said that.
I give you, you mean you want me to give you a paper directly?
Yes, and you tell him, here's your signature. Can you sign here?
Okay.
You just want to show your consultant or your examiner that you really know what's going on.
Okay.
And you want to consent the patient. Okay. There's a small mistakes grammatically.
Okay.
Not mistakes, but a better way to say some sentences. You can just review the recording later on, and you can. You said you are going to do. He's not going to do nothing. He's gonna an operation will be performed upon him.
Yes, you have been scheduled. You have been scheduled for. Okay, it's better to do like this, right?
He's not the doer. He's not the fa'il.
Yeah. Yes. You have been scheduled for procedure. Okay.
That's all right. I just want to remind Hassan here. You draw for your patient very perfect. I wrote it earlier for Hassan, but I forgot to mention it for whatever reason. Hassan, for your station, you need to draw the spleen for your patient. And you also explain the hematoma. I forgot to tell you that. Yes, you said during your complication, you said broken teeth. You should say there is a chance that we may break one of your teeth. It's not broken teeth.
Yeah, break your teeth.
Yeah. Yes. during when you mentioned the risk, you said if I mention the risk, you said that a right sentence, but there's a better sentence. You can say mentioning all these risks doesn't mean they're gonna happen.
Okay.
Or you should mention it this way. You said the only experience. You should say only experienced surgeon will be qualified to do your procedure. Okay? When he asks you a question, you say thank you, which is right. Nothing wrong about that. But instead of saying thank you, you can say thank you the first time. When he asks you the second question, you can say brilliant question. That's a very good question.
Okay.
So you just show your examiner that you have multiple vocabulary.
Okay.
When you explain the salivation, you said there is some lesion. I think the explanation of salivation should be direct, should be very short. Okay, Mr. Anderson, you have obstruction in your food pipe, and you usually swallow your saliva to your stomach. Because of this obstruction, you are not able to swallow all your saliva. So your saliva comes out. Just like that. You said it, but it was a long sentence, and it took a lot of time. When I said, is it a cancer? You immediately said, it's too early to say that. When I say, is it a cancer, that means I'm concerned. You can say, or it's better to say, Mr. John, I really understand your concern.
Okay.
Then you add whatever you want to say. You can say after that.
Okay.
Yes, you get that point.
Okay. Sympathy point.
When you explain to your patient after the procedure, he needs somebody to take him home. You said a long sentence. You can say you need to arrange a pickup, just like that. You need to arrange a pickup. And you consented your patient. Just put more effort in consenting. Okay. That's why before your exam, we'll give you more advice. If they give you a paper on the exam, take it with you, put it on your pocket. Don't use it for history. Don't use it for examination. Use it for communication skills. Use it to draw and use it to ask your patient to sign.
Okay.
All right? Okay. So in the history, we are not using a paper. We are not writing in a paper. We're putting the history in our head. In examination, we're putting examination in our head. When you come to the communication, you take the paper that they gave you for the history and the examination. You use it to sign your patient and use it to draw to your patient. Okay? Okay, Muhammad?
Yeah, very nice presentation, Al-Fatih. I think Ali covered all my points, so I cross it. I just have 5 points. The first one, Al-Fatih.
Yeah.
You should take the permission. I would like to discuss, is that okay with you? You said, I would like to discuss your investigation, but you didn't say, is that okay with you?
Okay.
Yeah. The second point, you explained you may take a tissue sample, but you should also add, we may need to do widening in your food pipe.
Widening, yes.
The third point, when you are explaining the risks, please mention a little bit about the treatment. Like infection, you can cover it by antibiotics. A small risk of bleeding will not affect you. And regarding the perforation, because it had a question in perforation, you should mention it. I think Ali remembered you. It may be a cut in his throat pipe.
Yes, the perforation. I reminded you the perforation. Yes.
It's crucial to mention perforation. The last point, Al-Fatih, Ali, let me discuss with him this point regarding the legal document.
Okay.
I think when you started summarize, you said to Ali, I need you to summarize to sign this paper, right? Before summarization, you should say, okay, Mr. Jack, as you want to do this procedure, this is a paper, contain your name and your agree to do this procedure, contain the risks and importance of this procedure. So I need you to sign this legal document.
Okay.
You should not mention it as something not important in your summary.
Okay.
Yeah.
I didn't mention as not important because when you summary, after the summary, I remember it. Yeah.
Yeah.
So, Mr. Muhammad, Mr. Ali, I wanted to tell you what has happened with me in this station during the examination.
I
answered all the questions.
In the exam?
Yes.
Let's talk about that then. So because this will be, we will recording it. Leave it to the end.
Okay.
We are waiting for your story at the end. Okay. Fine, Mohammed.
Okay, so the last station today, very nice presentation, Fatah Al-Fatih.
That's about Al-Fatih.
Yeah.
You didn't fail the station, but we're just trying to make it perfect.
Okay, I hope to do it. I have to do it by a higher score, but I will try to do it next time.
Yes.
Okay, the last station is an anxious mother, appendicitis. Who will take this station?
I can take it.
Okay.
Okay. Let's start, Mohammed. Give the scenario.
Mohammed,
we need to cover this video multiple times before we upload. Yeah, what do you want to say?
Okay, so the scenario, Ala, a 14-year-old girl with acute appendicitis is brought to the hospital by a neighbor. The mother, who is at work, becomes anxious upon realizing that the surgeon, Mr. Lee, is the same one who operated on her husband, who later passed away due to colon cancer. Answer Miss Anna questions. Reassure Miss Anna, okay? So let me put the 8 minutes and 40 seconds. You can start.
Hello, I'm Dr. Ala. Hello, Miss Anna. I'm Dr. Ala, one of the surgical doctor here. Can we discuss your child condition?
Yes, doctor, that should be fine. I have no problem with that.
Okay, that's nice. Do you know, can you tell me so far what do you know about your child condition?
To be honest, I have no information. I just feel very bad about my daughter. I don't spend much of the time with her, and I work long hours. I don't know what happened last time, and I feel guilty about this.
Okay, I'm really sorry to hear that, Miss Anna. Your daughter was brought into hospital by your neighbor. She having severe abdominal pain, and we examined her. And our initial discussion, our initial diagnosis, it was acute appendicitis. An acute appendicitis, it is an inflammation of the small part of your body, of the body. Have you ever heard about this before?
Yeah, I heard about the diagnosis, but I don't have any information about the severity and exactly like how serious is the condition. I just want to know, are you sure it's acute appendicitis, doctor?
Let me explain to you first what is an acute appendicitis. It's inflammation to the smallest part of the small bowel located in the left side of the body, and at of the left side of the body. And your daughter show the typical sign of the acute appendicitis, and we already start the management. We give her intravenous antibiotic and intravenous fluid.
So
but this is the
you sure? So are you sure it's appendicitis then?
We can say it is appendicitis unless we do operation and confirm it by operation.
But you said she has the symptoms, right, of appendicitis?
Yeah, she has she showed that.
It is dangerous, doctor.
See, for the children, because they have less fatty tissue in their abdomen, so if it may happen rupture appendicitis, but I want to assure you it will have the most skilled and expert surgeon will do it.
Who will do it?
Mr. Lee.
Oh, I know this one. Unfortunately, he operated on my husband, and my husband died, doctor.
Oh, I'm really sorry to hear that, Miss Anna. May I know how when he passed away and how?
He had colon cancer and died a few weeks after Mr. Lee touched him with an operation.
Okay, I'm really sorry to hear that again, Miss Anna. But let me tell you, this is a two different situation. Your husband mostly died because of the colonic cancer, not because of Mr. Lee. Because Mr. Lee, he is one of the best surgeon that we have here in our hospital.
Oh, you're just defending your consultant or whatever. Like, that's very inconsiderate of you, doctor. That's rude.
I'm not, but I'm telling you the truth that we have about our surgeon.
You said her appendix may rupture. What else could happen?
In some cases, maybe there's a severe infection could lead to block the reproductive tube of your children, of your child.
Okay. And what's the implication of that?
So it might end with subfertility.
What is subfertility, doctor? Please don't use medical term with me, please. I'm not a doctor.
Okay. The subfertility, the girl when she has a two reproductive tube, and the subfertility mean it's the child, the girl may be facing a problem getting pregnant. Yes, facing a difficult getting pregnant.
Okay. Facing difficult, so she can't get pregnant. But it's difficult.
Yeah, she can. Yeah, no, I'm not telling she will be infertile. She might have ability to be subfertile because she has another tube in the other side of her body.
Okay, won't be disfiguring, doctor.
There will be a horizontal small incision, but it could be a small scar. But in some cases, we need to extend it and will be noticeable.
Oh, okay. Can I see her then?
Yes, I will check and I will arrange for that.
Okay, that's fine. It's unfortunate, but it is what it is.
I can hear you again.
Yeah, I said it's unfortunate, but it is what it is. Yeah, if you can arrange for me to see her, that will be appreciated.
Yeah, I will. But let me summarize our discussion before. Your child having acute appendicitis, and we are waiting the consultant for operation. And I have discussed with you the risk and the benefits of this operation. And if you have any question, we are here to support you throughout this process. And you have any question and concern, please don't hesitate to contact us. Thank you for your understanding.
Yeah, that's fine. Good. How many minutes, Mohammed, remain?
2 minutes.
2 minutes. You have 2 minutes. Do you want to address any point?
Nothing.
All right, cool. All right, good. Very good. Good, Ala. That's a very good presentation. There's small points. You're going to pass the station, obviously. There are small mistakes here and there. You still have this area to finish your station fast. So slow down. Okay? Do you watch the recording?
Yes, I am.
Yes, so you can tell you still some rushing a bit, so you can slow down. You finished 2 minutes before, so you have time to ask every single question. Your tone need to be changed also. Like, be calm, Ala. Don't be in a hurry. And when she says something bad happened, I feel guilty. You said, I'm really sorry for that, but you didn't say, you said it like this. I'm really sorry for that, but you should say, I'm really sorry, Anna. I do understand. You need to change your tone. That's very important. You said the appendix on the left side. That's a new anatomy. The appendix on the right side.
Right side, okay.
Yeah, so that's a major one. You shouldn't wait for me to ask you what subfertility is. You should immediately say, and subfertility means this and this, as we said in the school, difficulty of getting pregnant. I'm glad you explained the subfertility by saying there's another fallopian tube that will compensate. In your presentation, you said your child having. You should say your child had. She had acute appendicitis. She's not having it. Acute appendicitis is not something that happens every 2 seconds. Okay? She had acute appendicitis, and that's it. But otherwise, you answered all the question in a good way. Good. You're gonna pass this station. You just need to work on this improvement I just mentioned. Okay, Muhammad.
Perfect, Ala. The first point, Ala, when Ali asked you about other complication regarding the fallopian tube, you forget to say may lead to subfertility. Ali remind you. You said this will lead to obstruction, and then you didn't say anything. Ali said to you what's going on after that. So you should mention this subfertility, okay? And the second point, Ali interrupt you a couple of times, but you should not, you should follow your track, okay? Because you skip to mention that you are waiting for the operative consultant. Follow your track, even if the examiner or the stimulator interrupt you a couple of times. That's all of my point. Very nice.
I just want to add one important point. In your exam, your patient is an actor. He's not a doctor. Sometimes they will forget to ask you some questions. You should be smart enough and you should answer the question even if they didn't ask it. Does that make sense? So let's say your patient didn't ask about the scar of the wound. You should be very smart. You should say, and by the way, Miss Anne, I just want to let you know, if she didn't ask, you should say, by the way, Miss Anne, I just want to let you know, this, we're going to operate on her and there will be a scar. This scar will not be disfiguring, but it's, you just mention the question that she didn't ask and you say it as a sentence. Okay? Sometimes your patient will forget to ask you questions, but you need this question to have your marks. Some examiner will ask you the question instead of the patient, and some examiner will act like they didn't know.
Yes.
Okay, that's a very important point. Okay, Muhammad.
We can